Please remain standing for the singing of our national anthem by Mr. Aaron Scarborough. Please be seated. Good evening. My name is Jeff Coben. It's my pleasure to welcome you to the 145th University Commencement Ceremony. On behalf of the faculty, staff, and administration of the School of Public Health, I'd like to welcome the class of 2014, Chancellor Christopher Kalenda, honored guests, family, friends, alumni, and other members of the university family who are joining us today. It's another great day to be a public health mountaineer. To the graduating class of 2014, I want to say it's been an honor and a privilege for me to serve as your dean for the past year and a half. As I've come to get to know you through meetings and lunches and other events, I could not be more impressed with your warmth, friendliness, and professionalism. I congratulate each and every one of you here today. I know that you've worked hard to achieve this important milestone, and we're very proud of you and what you have accomplished and what you will accomplish in the years ahead. I want to just take a moment to recognize the chairs of the various departments in the School of Public Health or their representatives. Please hold your applause, but if they would please stand. Dr. Matthew Gurka, Department of Biostatistics. Dr. Ian Rocket, Department of Epidemiology. Dr. Robert Duvall, Department of Health Policy, Management, and Leadership. Dr. Michael McCauley, Department of Occupational and Environmental Health. And Dr. Keith Zulig, Department of Social and Behavioral Sciences. Thank you. Of course, the chairs cannot accomplish their goals without the support of a strong faculty and administrative staff. And I want to thank the faculty and staff for all you have done to help make this day possible for our students, as well as for having taken the time today to come and help our students celebrate on this very special occasion. These folks are the heart and backbone of the School of Public Health. Will all faculty members and staff please rise and be recognized? I'd also like to thank and congratulate the many family members and friends who've supported our students during their time here at WVU. We thank you for helping them accomplish their goals. I want to recognize those graduates who have served this nation with valor and sacrifice as members of our military. The red, white, and blue cords these students wear today are a tribute to their selfless service. We also honor faculty, staff, and audience members who have served and are currently serving. Please join me in thanking them for all of their service to our nation. In the immortal words of William Shakespeare, parting is such sweet sorrow. We will miss you, and we are very sad to see you go. But we're also very happy for you, and we look forward to your many successes. Please remember that whether you were born here or chose to come here, you're now all Mountaineers. You will always have a place here in West Virginia, at West Virginia University, and at the School of Public Health. In turn, I hope that you will do all you can to improve the lives of the 1.8 million people who are proud to call this wild and wonderful place their home. Thank you and congratulations to the class of 2014. It's now my great privilege to introduce Dr. Christopher Kalenda, Chancellor of the WVU Health Sciences Center. Dr. Kalenda is not only one of this nation's leading health administrators, but he's also an accomplished clinical psychiatrist, a researcher, and he has his own master's in public health degree. It's his leadership and vision that is responsible for the establishment of the School of Public Health here at WVU. Please join me in welcoming Dr. Chris Kalenda.
Let me bring my greetings also from the Board of Governors, Mr. Alsop, who's representing the Board of Governors of West Virginia University, and President Gee, and to all the family and friends of the graduating class of 2014. Welcome to our home here among the hills, West Virginia. So one of the things I usually like to do is I like to have the graduates stand up, turn around, and thank those who got you to where you are today in a moment of sincere thankfulness for getting you through college and now through graduate school. So one of the things that I've been thinking about recently is the fact that really life is a journey. And I'd like to congratulate each of you on your accomplishments that we're celebrating today. And each of your journeys to this milestone has been different. You brought diverse sets of experiences to West Virginia University, from your homes, your towns, your home countries, from your families, from your prior schools, from the jobs that you've held, from your military service, or from your personal encounters with healthcare professionals who inspired your career choice in public health. But along the way, you've been supported by many people, your parents, your siblings, spouses, friends, and children. And if we've done our jobs as faculty members, we will have supported you as well, not just in learning facts and skills, but in opening up your eyes to a world larger and more complex than the one that you knew when you came to West Virginia University. Now, as you move on to your next part of your journey, your travels through life will be guided more fully by your internal compass, the sum of the knowledge, the values, the judgments, the moral character, and the experiences that you bring with each and every crucial turning point in your life. I actually urge you to treat this as a journey, as an explorer and not just as a tourist. And I think there is a difference. Tourists follow the routes worn smooth by those who came before them. Explorers, in the words of Robert Frost, chose the road less traveled. Tourists take pictures of the people and places they visit and buy souvenirs. I've certainly done that. And explorers talk with people along the way and collect experiences. Tourists are consciously separate from the places and the cultures that they visit. Explorers are actively engaged with their surroundings and their companions. Tourists stay safe. Explorers take risks. I'm not talking about the vacations that you will take, although I hope that you take some great vacations over the years. What I'm talking about is your path through your career and your individual lives. Each day, you will have opportunities to explore new experiences, to engage new people, to challenge your own beliefs and those of your peers and your colleagues. Opportunities to make a difference. You won't see these opportunities if you have your nose buried in the guidebook. There really is no guidebook for most of what you will encounter out there in life. You will have to make your own guidebook in your head. Your experiences with WVU will well equip you to do this. And as you join the ranks of mountaineers serving all over the world, follow their example, explore, and send us a postcard from the road less traveled from time to time. Thank you and congratulations on all of your hard work.
Thank you, Dr. Kalenda. Thank you for your inspiration today and for your years of outstanding leadership here at our Health Sciences Center. It gives me great pleasure to introduce our 2014 commencement speaker, Dr. Carolyn D. Woodhouse. Dr. Woodhouse is currently a senior research scientist at the Center for Health Equity and Quality Research at the University of Florida College of Medicine. Prior to joining the University of Florida, she served as Associate Dean for Academic Affairs and then as Interim Dean of the School of Public Health at Georgia Southern University. She served on multiple national boards, including 2 terms on the Board of Counselors of the Council on Education for Public Health and 2 terms on the American Public Health Association National Education Board. Dr. Woodhouse is the recipient of the Distinguished Alumna Award from the University of Cincinnati College of Education and the Distinguished Career Award in Scholarship and Research from the American Public Health Association. We're honored to have Dr. Woodhouse with us this evening at our commencement ceremony. Please join me in welcoming her.
Yes, thank you. That's it. Okay. Thank you very much, Dr. Coben, for that kind introduction. Yes, you have. I am so pleased to be here. I am really excited about this because it's a very memorable occasion for the College School of Public Health as you're moving into your accreditation. You soon-to-be graduates are earning your degrees in public health from an emerging and exciting new School of Public Health. A School of Public Health that, in my opinion, is being developed right here where it is really important to be with these seemingly intractable health issues that require the infusion of an institution and professionals with the capacity to make really positive change. I've been hearing a lot about that over the last several months while I've been working with them on the accreditation. I have recently spent 7 years developing and preparing a newly accredited School of Public Health located in what we call the stroke belt of the Deep South, which is equally intractable health problems. So I know the type of ownership and investment that many of you students, faculty members, and administrators are making. It takes significant effort, excuse me, to simultaneously move your careers, your personal goals, and this institution forward. But you are poised to make a positive difference in West Virginia. To date, you have made incredible progress, and it has been a pleasure to watch you grow. Having been a professor of public health and serving for almost 30 years in many levels of upper administration for public health programs and schools, I've had multiple opportunities to plan, speak at, and oversee graduation ceremonies. And I look out over this wonderful group, and I tend to recognize some of those facial expressions. There's a unique but familiar combination of pride that you feel and pride of your accomplishment, but there's also an apprehension for the tasks that lie ahead. Both are applicable and both are warranted. I encourage you to remember these feelings and keep them with you as you continue to face the future professional challenges. The tension between them is really what will drive your successes in public health. You have both the pride of attaining many necessary skills, but you need that necessary angst to facilitate using the skills in creative ways. And believe me, it will come your way. Keeping your feet on the ground, being grounded in the process of making change is the important mindset. There are few areas of graduate study which provide such a unique foundation as public health. When you apply it at the macro level, these skills and attitudes are known to facilitate significant improvements in the communities and states where people live. That is why they're included in the curriculum. You have earned your degrees because you have successfully demonstrated the unique competence, but improving the health of the public in very diverse settings creates significant challenges, and it will never get easier. You will be working in increasingly complex situations involving increasingly types of varied communication, numbers of stakeholders, and all of your actions, and I repeat, all of them, will have increasing amounts of political ramification. You, as graduates, are now the navigators through this multidimensional set of issues and stakeholders, and you all are going to have to lead the way. Many, or perhaps most other professions, look at health-related issues through a single lens. They have learned to define and have attempted to solve the problem through this single lens. Those of us in public health are trained to see the complexity of situations, be they the individual, the community, the national, or at the international level. This complexity is the context in which problems or issues are experienced, the social milieu, if you will. And a big part of your contributions to change will be to ground the problem solvers and the stakeholders in this context. If you do not do it, no one will. In essence, you have to champion the relevance of context. As many of my professors, and yes, many those years ago, I had a number of professors, and I am sure yours as well, said to me, and as I say to all my students, there are no universal solutions to complex problems. And the more emphasis you, the public health professionals, keep on that complex context of issues, the more effective your interventions or policy changes can be. So my message to you is, become the champion of context. But being a champion is never easy or without pain. So I'm going to share with you some stories about how I learned the importance of context and how I know it is now your job to keep pushing context to the forefront of problem solving. Back in 1973, I graduated with a degree in psychology. My required research project was to be on birth order research. Background literature said firstborns were smarter of the siblings. I was a firstborn. Sounded like a good thing to study to me. Certainly I was not biased. My lab partner, also a firstborn, agreed. We developed a great research protocol. Before we collect any data, the professor sat us down. His first statement, as you can probably guess, was, "I bet you were firstborn." A great discussion on conducting research to prove what you already believe or through which you stand to gain something ensued. But the professor asked, what if because of research like yours, they stopped educating third-born children? The guilt feeling stuck with me. I became hypersensitive to context or to the potential negative impact of findings on research participants. Right after we completed our revised study and I earned my undergraduate degree, I took a research position as an assistant with a psychologist specializing in mother-infant interaction research. My job was to document how mothers interacted with their newborns using a predetermined check sheet. The check sheet allowed me to record specific types and frequencies of behaviors common between mothers and infants. A few weeks into the job, I realized the researcher was collecting data on race, but no data on socioeconomic status. It was 1974 in Cincinnati, a very provincial, segregated city in the midst of a serious heroin epidemic, as it is today. The hospital was and still is in the middle of a very poor area of town. Many of the inner city mothers, about half of whom were Black and very poor, were addicted. They came to deliver babies, And before that, some had been shooting up. Yes, that is horrible. Yes, that is not okay. Yes, it is indicative of a much larger set of social problems that we're not going to process today. However, that particular situation was not a defendable or ethical context to use to compare black and white mothers' interactions with their newborn infants. I told the researcher that some of the mothers and babies could not interact because they were asleep. So the assumption that the type of interaction was comparable, in my opinion, was inaccurate. I was told to collect the data. I talked to the staff nurses and held some of the very small infants in my hands. It was clear to me that I was holding poverty and dependence, but the researcher was seeing race. Though I could not articulate it as yet, I was becoming a champion of context. However, I was a champion without a voice. Let's just say I did not have to quit that job. Obviously, I needed more credentials if I was going to be part of developing quality research. So I decided I would have to go to graduate school in the near future. A few years later, I was working in Cincinnati as a program developer as part of a multi-site federal agency research project. Again, the project was in a very poor, predominantly black part of town. The project was a clinical trial of a core curriculum to help what we called less chance adolescents finish high school and avoid pregnancy. There were 16 girls, some of whom already had babies. The cross-site project evaluation agency, funded by a federal contract, was using a set of what they called validated measures. For those of you who are not researchers, that term basically means, or as they say it means, the measure had already been demonstrated to accurately measure what it claimed to be measuring. In this case, it was ostensibly measuring potential improvements in self-esteem. I came to realize the measure was very inappropriate for the context. First, the girls could not read at the level required by the surveys. I spoke with the evaluators, and they told me I could read the instrument to the girls and record their answers, but not to note that on the surveys. Because of this change, I was able to experience an important epiphany in my professional career. I saw that the girls kept looking at their thumbs. You might ask, how can that be an epiphany? Well, one question on the validated measure of self-esteem about which they were to express their level of agreement was, sometimes I feel like I'm all thumbs. A very common expression indeed, but not for this group of socioeconomically disadvantaged youth who kept looking at their thumbs with a very confused look on their face. I talked to the evaluation agency about the problem. I tried to articulate that I did not believe they were measuring self-esteem in this context. Clearly, the researcher evaluators did not understand or consider important the context in which they were trying to demonstrate change. However, as you can imagine, I did not have to quit that position. It was at that point that I went to graduate school. These early lessons have stayed with me. I have gained the understanding that problems are never as simple as they seem, and I'm reminded every day that there are no universal solutions. This is my professional context, and it has allowed me to keep the following things in mind as I deal with researchers, policymakers, funders, colleagues, and students. The traditional training of many professional people devalues individual experience, social milieu, and the elements of the environment, which I call the context. It is devalued because, as researchers say, it is noise, or as my 22-month-old grandson says, it is messy. It is our job in public health to illuminate context, to keep the uncontrollable noise at the forefront, because that is how we empower people. Keeping lived experience and the complexity of environmental interactions at the forefront of community improvement and policy development is, I believe, the most important role for graduate-level public health professionals. So I challenge you to keep using the voice of people to emphasize the role of context. People de-emphasize context as a way to maintain their own prejudices and justify their learned attributions. It is always easier to blame victims of the context if the context is irrelevant. So my final message is to never underestimate the importance of what we have learned to call the fundamental attribution error as you try to keep context on the table. Though some people do not fall into this trap, most of us do. We have learned it well from the people around us. The attribution error is simply our likelihood to see the context as the cause of bad things that happen to us, and to blame other people's traits or habits for the bad things that happen to them. If I have a car wreck, I'm more likely to say that the yellow light was too short or the street was too slippery because of something like cheap blacktop. If you have a car wreck, I am much more likely to say that you ran a red light or you were going too fast because of a road-covered road, which makes you a reckless driver. In the context of public health, it is assumed that people who are obese with obese children just feed their children sugar and soda pop by choice, instead of recognizing that the likelihood of an affordable grocery with fresh vegetables and fruits being accessible is extremely low. It is always easier to blame the victim than to change the system. Teach people about this error and reinforce the understanding frequently. Once they learn it and really comprehend that they're guilty of it too, it is always easier to keep context on the table. I encourage you to look for your own lessons, such as those I've relayed here today, early in your careers. Avoid establishing norms that validate simple assumptions. Use the stories you find in interactions with other professionals and policymakers, because again, you're the only ones who are going to keep it on the table. Repeatedly collect and tell the stories that highlight the importance of context, no matter what situation you are facing. And lastly, remember it's your job to train the generations of public health workers with whom you will interact, or any students you can influence, to be fellow champions of context. There are no universal solutions, and keeping the focus on the uniqueness of the context of our efforts, being the champion, will always go a long way toward improvement in the situation at hand. Your important new School of Public Health is developing here in this context primarily to support the improvements in public health most needed in West Virginia. Your efforts to become an accredited School of Public Health will serve to validate your institutional quality and your capacity to provide the leadership needed to orchestrate and support the change process. The accreditation would also allow your successes to be more easily recognized on the national and international level, and will help focus resources where they can do the most good. Earlier this week, a national news broadcast ran a follow-up story to the West Virginia water contamination events and the ongoing aftermath. Clearly, creating the system changes needed to improve the long and short-term economic, social, environmental, and political impacts, and ultimately improve public health and well-being, will require the leadership of your institution and all of your graduates. Becoming an accredited School of Public Health will exponentially empower your efforts to support changes that positively influence public health. The leadership of the School of Public Health is working extremely hard with the faculty and the students to help you achieve this accreditation. You are nearing a critical juncture, and it is well worth the extra work. Best of luck to all of you graduates in your future endeavors, and thank you again for the opportunity to share my thoughts.
Thank you, Dr. Woodhouse. Okay, we have a special event. I'm going to encourage you all to stand for this. Mr. Aaron Scarberry will now sing "My Home Among the Hills," composed in 1963 in honor of West Virginia's centennial celebration by Clarksburg native Mr. E.W. James.
There's a land of rolling mountains where the sky is blue above, and though I may roam waterfalls and mountain rills. My heart will be always in the West Virginia hills. Their autumn hillsides are bright with scarlet trees, and in the spring the robins sing, while apple blossoms whisper in the breeze. And there is music in the flashing streams, and joy in fields of daffodils, laughter through the happy valley of my home among the hills.
Good evening. Or you may sit down. Thank you, Leah. Good evening. I am Dr. Gilbert Ramirez, Senior Associate Dean for Academic Affairs and Educational Effectiveness in the School of Public Health. Now is the time we have been waiting for. I would like to invite our School of Public Health graduates to stand. Now you can stand back up. And make your way to the stage. For the stage party to assume their positions, and families, I would like to remind you that the left and right front rows have been left empty for you to take a picture of your graduates. Kaylee Taylor Aloya. Katie Lynn Anderson. Lauren Elizabeth Branch. Sarah Mitchner Hanks. Jenna Elizabeth Hardy. Curtis Franklin Hayes. Jonathan Hersick. Allison Renee Johnson. Rami Katrib. Chelsea Laswell. Jennifer Louise Lolchik. Heather Dorothy Ogle. Amanda Paul. Pete Angelo Patrides. Margaret Power. Mark Riffon. Samantha Alicia Shawley. Caitlin Elizabeth Weber. Graduates, please remain standing. Dr. Kalinda. Dr. Kalinda, I present to you for degree conferral the graduates of the degree programs in the School of Public Health.
Candidates, your fields are critically important and improve people's physical and mental well-being. And WVU has always acknowledged the health as a basic value of our society. As you enter into a profession of great responsibility, I trust that you will hold foremost in your thoughts and plans the communities that you serve, the people of West Virginia, the United States, and the world, who require your skills in research and service. As West Virginia University's graduates always aspire to put your education to work exploring our world's greatest problems. Continue to cultivate your global awareness and aim to create a more peaceful and just world, and constantly refine your abilities to uncover facts, analyze problems, and communicate clearly. Dream big and never stop learning. So by virtue of the authority vested in me by the West Virginia University Board of Governors, I hereby confer upon you the degrees for which you have been recommended, with all the rights, honors, privileges appertaining thereto. Please join me in congratulating West Virginia University's newest graduates. You may take your seats.
Hi, my name is Ruth Kirshner. I'm professor in social and behavior sciences. You all are welcome to call me Ruth. I'm going to try to find my place here. Let's see. Oh, here we go. All right. First of all, before I introduce our final guest today, I want to say a thank you to some people that are sitting here. It doesn't it's not always apparent that how much work it takes to put graduation together, but we have some folks here that have done a really outstanding job for us, and I'm going to mention them by name. First name, we won't have a quiz, so we'll just do first names. And so Norma and Brenda, are you all still out there? Okay, could you raise your hands here? I see Norma, thank you very much. Leah Adkins and Tara are out there, and also Teresa, who help so much with graduation. So we really appreciate that. I also want to say a few words about some of our volunteers that are here that are some of our students. And they are Andy, Megan, Emily, Kristen, Amy. Could you all raise your hands, please? And I'm going to say Amber, too, because I think if I don't, I'll be in trouble. So, right, Amber? Am I correct about that? So thank you all very much for your effort. It takes a lot to put graduations, especially as many as we have across the university. So it is my great pleasure today to introduce Dr. John Blosnich, who is a postdoctoral research fellow for the Center for Health Equity Research and Promotion with the Department of Veterans Affairs in the Pittsburgh Health System. He earned his PhD degree in Public Health Sciences in 2001 from the Department of Community Medicine at West Virginia University. His research areas of expertise include mental health. I was actually his very first case study, I want you to know, interpersonal and self-directed violence, and tobacco use-related disparities among lesbians, gays, bisexual, and transgendered individuals. After completing a postdoctoral training program in suicide prevention at the University of Rochester, Dr. Blosnich joined the VA to develop a program of health equity research focused on LGBT veterans with specific attention to suicide risk and social determinants of health. It's my great privilege to introduce one of our WVU alumni, my colleague, and most importantly, my friend, Dr. John Blosnich.
Good afternoon, everybody. Hello, graduates. It's not too long ago that I was sitting in that exact same row of seats as you are today. On behalf of the WVU Alumni Association and all the graduates of West Virginia University who have preceded you, I extend to each member of the class of 2014 congratulations and best wishes. Today, you're joining a legacy of success that reaches back almost 150 years. Each WVU graduate has a unique story, and now it's time to write yours. With that in mind, class of 2014, from graduates everywhere, this is our charge to you. Work hard to develop your unique gifts. Take risks. Don't fear making mistakes, and always be flexible. Cultivate a global perspective and work towards creating a more peaceful and just world. Think for yourself and always choose to be an innovator. Explore new perspectives and places, and as you travel the world, wear your flying WV with pride. Honor the sacrifices of those who came before you and extend a helping hand to those who will follow. Above all, never stop learning. And when people ask you about the secret to your success, tell them you're a mountaineer. Thank you. Congratulations.
I'd like to ask everyone to please stand for the alma mater.
Almost heaven. West Virginia, Blue Ridge Mountains, Shenandoah River. Life is old there, older than the trees, younger than the mountains, growing like a breeze. Country roads take me home to the place I belong. West Virginia, mountain mama, take me home. Country roads, I hear the voice in the morning as she calls me. The radio reminds me of my home far away. And driving down the road, I get a feeling that I should have been home yesterday. Yesterday, country roads take me home to the place I belong. West Virginia, mountain mama, take me home. Country roads take me home. Country roads take me home. Country roads.
Wherever the roads take you, whatever roads you follow, please remember to bring those country roads back home. Please be seated. I'd like to again thank everyone for attending. I'd like to congratulate the class of 2014. I'd like you to remember to join us. I'd like to invite you all to join us for a reception following this graduation. I ask that everyone in the audience please remain seated while the graduates recess out of the stadium. Once again, congratulations to the class of 2014.